Welcome back. Eczema is a chronic condition marked by itchy, inflamed skin and affects millions of children and adults. Topical steroids are the most commonly recommended treatment for eczema and psoriasis, but using them for too long is linked to serious skin withdrawal side effects, which can be worse than the original symptoms. So here today with how he has helped thousands of patients come off steroids is Dr. Marvin Rappaport, former clinical professor at UCLA and leading authority on eczema treatment and topical steroid addiction, along with John, who has suffered from steroid addiction for years. So thank you both for being here. Dr. Rappaport, we'll start with you, and we'll start with this. What is eczema and what is the cause?
Good day, Emily. It is an inherited disorder. It typically is seen with a parent or two parents having eczema, asthma, or hay fever. The triumvirate can be all inherited. Basically, it is an inheritance of itchiness and a little bit of mild irritation from food, from slobber. Little baby, 3 to 6 months, gets a little rash on the cheeks. Then they start getting a little itchy in the crook of the arm or behind the knees. That was pre-steroids in the 30s and 40s, and it burned out at age 6 to 9 in almost 95% of the patients. Or they went to the beach in the summer, sunshine, goodbye, rash. Adults did not have eczema. They had some itchiness, period. Now it's a monster being fed by the steroids, which feeds into one of the inherited factors, which is a feeling of coldness, a look of pallor, no matter what the ethnic group. They get pale and they do not like the cold and their fingertips are chilly. And steroids closes the blood vessels down more. It feeds this monster.
Okay, this is all very interesting, and I have heard other clinicians talk about the power of the sun. So it's so interesting to hear you say that linked to eczema. So you mentioned there that steroids are the most commonly prescribed treatment. So explain exactly how the steroids work, but then what are the risks of using them long term?
Well, basically, steroids has multiple factors going for it. Good drug. I like it. It's anti-inflammatory. It's anti-itch. It closes blood vessels down. Basically that. It makes little blisters go away. But basically it stops itching. And the factor in poison oak or a little bit of a rash or a mild case of dermatitis, it goes away within a few days. With eczema inherited, so more steroids are put on, and the child gets addicted after 4, 6, 8 weeks, where more rash comes on, it spreads, mother goes back to the doctor for a stronger steroid, that's called addiction, and it's smeared all over the body. And we have a problem, a real major problem.
This is you frame this in such an interesting way. So John, I want to ask you, what has your experience been with steroids and what was the addiction like?
Well, it was textbook. I went to the dermatologist, started with a mild strength of topical steroids. It made the itching and the redness go away, and that lasted for a time, and then it came back. And just through a series of stronger and stronger topical steroids, and it created an issue where they were no longer effective. And that was when I found Dr. Rappaport and started this journey of topical steroid withdrawal as a result of being addicted.
So doctor, you're an advocate of a different approach to treating eczema. What do you recommend, and what type of results are you seeing?
Well, it's amazing that what I have seen in the last 40 years are addicted patients only. I don't see that virginal little 3-month-older. They're already on over-the-counter steroids that the parents have bought. So they're already addicted and it's not working, and they've gone to a dermatologist or allergist and gotten a stronger one. So I'm seeing an addicted kid instantly, just like that. I rarely have seen a de novo untreated eczema child. And when I have, and there have only been a few, I tell the parent, relax, it's only a little rash. You don't have to worry, it will go away. And a little lubrication in the water, bathing, sunshine when it comes out, no matter where you live, this will go away.
It's so interesting to hear a clinician frame eczema this way. So John, what was the steroid withdrawal like?
Oh my goodness. It was awful, to be quite honest with you and blind. And people can go on the internet and Google topical steroid withdrawal and be just horrified at the photographs. I, along with others, looked like a burn victim. And when I found out about topical steroid withdrawal and started doing research and looking at the pictures, I can safely say that I had it good. I looked awful, but I had it good to some of the people compared to some of the people that are out there. But what really happens is it takes, and this is unbelievable, 3 to 5 years to get to normalcy. Nothing can speed it up. All of the remedies that all my friends threw at me, gluten-free, all of these things, were essentially ineffective. It's just time. Time is the only resolution to the problem. And I would just add one thing. I keep thinking that I'm done and I'm clear and I feel great. And then looking back on that opinion 3 months after the fact, it's like, my God, I'm even getting better. So I don't even know what normal is anymore because I just keep improving, all with no drugs and no treatments.
Well, that was going to be my next question, is where you stand now with your eczema, but it sounds like you are improving every year with the help of and the care of Dr. Rappaport. Dr. Rappaport, you're now using telemedicine to help patients around the world that are suffering from steroid addiction and withdrawal. So how can you help people maybe here in our area who are suffering from steroid addiction?
Well, the basic tenet is you must stop the culprit, the steroids, like any other addiction. That's the start, and they go through a little bit of initial help. My therapy is to support them with symptomatic care, so you treat the symptoms to ease the pain and ordeal they're going through.
Well, it sounds like a success story that maybe can be applied to many, many cases. So we will put the information on how to get in touch with Dr. Rappaport. If you have eczema, if you are suffering from steroid addiction and you are going through steroid withdrawal, or you'd like to talk about what your options are, we will have all the information. Doctor and John, thank you so much for being here today.
Thank you.
Thank you.
We appreciate it.